everyone, and welcome to episode 5 of the COVID-Novid podcast with your host, Puck.
And LongwoodGeek.
All right, so let's jump right into this.
This is covering the press briefings from 3/26/2020. So take it away, Puck.
Alrighty, so per President Trump, 151 nations are currently infected.
And amazingly, the U.S. has surpassed China with the highest number of positive cases. And in fact, per Vice President Pence, 5 of 10 counties in the United States are the top infection areas.
Trump spoke with G20 leaders about how to handle the virus and exchanged info at 12 p.m.
So he has a proposal to deploy troops to the Canadian border. Unfortunately, the Canadians hate it, but we already have troops at the Mexican border, so he's seeing it as kind of an equal. We're keeping everybody out.
Yeah, he did send a letter to governors about the data we're going to be gathering for more social distancing recommendations.
And with Vice President Pence, he stated that 19 of the 50 states that have had early cases have kept persistent low numbers, less than 200 cases measured over 3 to 4 weeks.
Yeah, and we're still seeing over 50% of the new cases and 55% of all cases from New York.
Unfortunately, we're seeing 2 new hotspots here in the United States. We've got Wayne County, Michigan, and Cook County, Chicago. They are becoming hotspots with rapidly expanding cases, especially in the urban areas. But 86% of the people that have been tested so far are negative.
We're working to get the antibody test to determine if folks who are asymptomatic are carrying the virus.
Interestingly enough, I had an antibody test several years ago to determine what autoimmune disorder I have. So I do know that unfortunately it can take some time to get that testing done. I believe it was about a month from when I had from my previous doctor's appointment to when they had the results. But on a good note, Dr. Burke stated that we've been able to define to date the spread fairly well.
And we're approaching day 15. Trump will be examining data carefully and presenting this weekend the range of recommendations and additional guidance to going forward.
And we will be, if there are press briefings this weekend, we will be putting podcasts up for them as well. If they are short or they are not very in-depth, then we'll do a recap one Monday morning. Trump is pushing for all of us to go back to work. He wants everyone still practicing social distancing if we do, and it may take large sections of the country to send people back. He'll be talking about it next week.
Dr. Fulci said that this virus could rebound or cycle into the next season.
It'll likely be the middle of summer for the end of this phase 1 of COVID. Phases 2 and 3, there will likely be a note of how efficient these treatments are becoming for them, but the next season could be anywhere from a year to a year and a half.
Trump said that the National Institute of Health and the private sector continue to work with FDA to test treatments for corona, so hopefully we'll see something that is effective with these rounds of treatments.
But with that, they need data, and Vice President Pence has stated that over 55,200 tests have been completed.
And on the testing front, Abbott Labs submitted request for the point-of-care test approval for the doctor's office. You get results in 15 minutes, and it's a self-swab test.
Oh, that's excellent. I will tell you, the self-swab tests, I don't know if they go all the way back like the others do, but make sure that you don't sneeze, cough, or flinch as you're doing it. It can ruin the test, and you'll have to redo it. So just try to tough it up and take it on the first time. As someone who had a camera up their head quite a few times before the head tumor was removed at age 16, I know it's uncomfortable. I know it doesn't feel good, but it's the best way to get this diagnosed.
The self-swab test actually, according to Dr. Burks, you swab the front of your nose.
Oh, so you don't have to go all the way back.
No, you only have to do like the inside of the canal.
Oh, that's
not
awesome.
all the way
That'll
back
make it
to
a
your
lot
sinus.
easier for most people. It does appear that the SARS antigens that are developed after contracting SARS are reacting well to COVID-19.
Well, COVID-19 is a form of SARS, isn't it?
I think it's classified as such. I will need to look that up, and we'll try to mention that in the next episode. I'm not 100% sure on that, but I think it shares some similarities.
From Dr. Fulci in regards to therapies, different drugs will be going into the randomized control trials, and that's the best way to find the best drug as quickly as possible. If a drug is not effective, we get it off the board. If it is, get it out to people.
And he did also clarify some points on a vaccine. Vaccines will not help immediately, but there are a couple of handfuls of vaccines that may help in some fashion. It's not something that unfortunately will help with this cycle as much, but the next cycles it should actually show some efficacy.
So, what's taking so long with like developing a vaccine? Can't you just like jab somebody with it and be done?
Well, so they've been doing that in a couple of instances. Several scientists have basically given themselves the vaccines to test. Normally, what you would do is you'd have to run it through human clinical trials. There's different types of vaccines. There's live virus, dead virus, synthetic, and you need to make sure that the one that you're using, one, isn't going to hurt people. Because if you do, say, live virus ones really are used, not really used, but dead virus and synthetic are the most common, and you have to make sure that it's not going to cause an adverse reaction in people. There are some people that are allergic to different parts of vaccines, and there are parts of the vaccine, the dead parts, that can trigger other reactions in the human body. So you really, Dr. Fulci's correct in that you have to test all aspects of safety of the vaccines, because the preventative could be worse than the disease itself. But on the front of making things that work, healthcare workers are getting an anesthesiologist ventilator conversion webinar sometime Friday or over the weekend to assist with converting them to emergency use.
Yeah, there are still some ICU beds and over 2,000 ventilators that aren't being used in New York at the moment. I actually watched a thing yesterday about how bad things are there. Please continue practicing social distancing.
And self
I don't want to,
quarantine. If you are from the New York City, New York area at all, if you have traveled, please be self quarantining.
yeah, I don't want to scare anybody, but the deaths have gotten so bad, their morgues are overflowing and they have to use refrigerated trucks to take the bodies out. So this is really serious. Please continue to practice social distancing and quarantining.
Now, you, as a former healthcare worker yourself, what can you tell me about the suggestion or the fact that we don't need to set up DNR for most Americans yet?
So,
And what is DNR?
DNR means do not resuscitate. That means if you start having a heart attack and you are unresponsive, or go into cardiac arrest is what I meant to say. Um, or just you stop showing any like living functions. They are not to do anything to resuscitate you, you know. No defibrillators, no intubations. They're just to let you basically shuffle off this plane of existence. According to Dr. Burks, we're not at a point right now that people need to be discussing that with their doctor if they get sick. So,
I'm surprised they
because
brought it up in the briefing itself. I guess it's to reassure people that we're not at that state yet, but that it just seemed odd to include that.
yeah, I agree. That was it was just kind of a random comment that she made, and I'm like, wait, what? Why? If things aren't that bad, why are we discussing doing that now?
Exactly. But on the supply front, again, with some ventilator conversions, some ventilators that haven't been used yet, Trump has only had to use the Defense Production Act for two minor companies. Most of the big companies want to do the work needed to get us on the right foot. I don't know the two companies. I don't think they were listed, but
They weren't. He said that he's going to bring them to attention sometime this week, though.
well, I mean that's great that he's only had to use it twice. I mean, I know we've been hearing about donations from a lot of big companies, which is fantastic, and I hope they keep it up. That's part of the social contract we have. If we have, we help people. And that's just the way we're supposed to be. Speaking of helping people, Hospital Ship Comfort is leaving on Saturday instead of 3 weeks from now. They'll be going to New York City and will be docked at Pier 90 in the Manhattan Harbor by Monday. They're currently in the Norfolk Naval Base here in good old Virginia.
Yeah, whenever I found out that they were closed, I was kind of like, I kind of want to go see it, but no, I don't, because social distancing.
They wouldn't let you on anyways. Tours of ships like that require special permission. Like if you have a family member that serves on board, they might be able to give you a tour, or if you become a patient. But that's not something that they normally just hand out to anybody.
I wasn't talking about a tour. I mean, just walking up and looking at the ship and being like, oh, so that's comfort. But I want to
I guess that
stay,
would be rather comforting.
I was going to say, I want to stay as far away from it as possible, and I know you do too.
Well, moving on to a financial front, we had discussed the financial relief package. Puck, what can you tell me about it?
So it finally got passed by Senate in a vote of 96 to 0 yesterday.
I heard that the one person who may have voted against it was actually in quarantine for the coronavirus.
Yeah, and it's It's supposed to be a really, really good package too. Now it just needs to go in front of the House of Representatives to get a vote.
Well, I'm glad that they really got it passed because we now have over 3.3 million unemployed.
Yeah, the good news is President Trump said that with insurance for the unemployed, they're doing a lot of different things for it.
The National Restaurant Association says that 3% of all restaurants have shuttered for good, with another 11% closing in the next 30 days. As someone who has a lot of friends in this industry, I can honestly say if you can afford to, buy some gift cards. If you know you're going to eat there, buy some gift cards. Or buy some gift cards and have the restaurant give them away to people. I'm actually working on doing that with a friend of mine up in Maine. I want to buy a $40 gift card to their restaurant and then just have, because I'm not from Maine or visiting there anytime soon. So I want to have it raffled off to somebody local in the community.
Well, that's like, Fisher's slash Big Boy. They're not exactly, from what I understand, they're not exactly corporate run. If you can get a gift card for one of those, it's got a very mom and pop kind of feel to the diner. You could take and host an online raffle for that.
Yeah, and we definitely recommend doing it for any small businesses. Restaurants are just what we're focusing on right now, but if there's any small business that offers gift cards, buy them because they can use that money now. And again, you can use it or you can give it away for later. There's nothing if they're offering it, there's nothing stopping you from getting them, and that's for any industry. We were just mentioning the restaurant association. And I believe March 30th, they're having a National Takeout Day is being recommended, where you go out and you order takeout or delivery from some of these restaurants that are offering it.
Ooh, so does that mean we're gonna get Chinese that day?
There's a very good chance that will be on on Monday, so we'll probably get some Chinese then. We have a really great restaurant near us that is a small mom and pop that we want to keep supporting.
Absolutely. Yummy, yummy.
Speaking of those big companies, what have we gotten any other major donations from anyone?
Yeah, we got 5 million from Anheuser-Busch.
It's interesting. We were talking about this last night. I don't know if Anheuser-Busch has done it, but I do know that Budweiser at one time, they, in certain critical situations, they've actually switched their production to canning water in their beer cans for relief in areas that don't have clean water. So it's good to see companies like Anheuser-Busch stepping up and doing stuff like that.
Every time I hear Anheuser-Busch, my brain automatically goes St. Louis, Missouri.
Well, we've got Busch Gardens here in Virginia that used to be owned and run by Anheuser-Busch. I don't think it is anymore, but that was actually something that was started as kind of a theme park by Anheuser-Busch.
Whoa, 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 wait, wait, wait. So, whenever The Simpsons had Duff Park, was that a reference to Anheuser-Busch or the Busch Park or Busch Gardens?
Yeah, I believe so.
Oh my gosh. I did not know that.
Well, the only other thing that we've got to mention so far, speaking of not knowing it, is I didn't know the stock market is back up over 4,000 points from the past few days.
Mm-hmm. Yep. Things as far as stocks go are going quite well, which with everything that's going on is quite surprising.
Well, there's a lot of surprising stuff going on, so it's not surprising that there's things like that we're missing or hitting out or that's hitting on the far end of the radar. That's one of the reasons why we want to do this podcast. It's because there's all sorts of stuff that people don't know are going on or don't have the time to research. And we're happy to listen to those briefings and get you guys the information that you need. Puck, do you have anything else?
Nope. It's pretty much all that I was able to find out for yesterday, so we will keep you all updated as new things develop.
Fantastic. This has been Longwood Geek and
Pot!
here with the COVID-Novid podcast, episode 5 for the press briefings from 3/26/20. As always, everyone, you need to stay compassionate, stay safe, stay well, and we'll catch you guys after the next briefing. Thank you very much and have a wonderful day.
Bye, everybody!
Bye.